Cardiopulmonary exercise testing, CPET, also called VO2 max, is a specialized type of test that measures your exercise ability. This test provides the physiologist, doctors, and clinicians with valuable information about the function of your heart and lungs under the stress of exercise. Cardiopulmonary exercise testing at Aspetar can be done for clinical assessment and to assess your physical performance. Cardiopulmonary exercise testing can be used to help determine proper exercise prescription for people in cardiac rehabilitation. The test is also quite valuable for athletes, especially endurance athletes, because we can determine the proper exercise intensities to enhance your athletic performance. On the day of the test, you should wear comfortable clothing for exercise, including proper shoes. It is not recommended to exercise on the day of the test. You should be fasting for 3 to 4 hours on the day of the test, eat lightly, and avoid drinking coffee. In addition, avoid smoking shisha, cigars, and cigarettes on the day of the test. Your doctor should consult with you if you are taking medications and whether to take them on the day of the test. It is usually recommended to take medications as normal unless instructed otherwise. Before you start exercise, you will first perform a pulmonary function test. Once the spirometry test is completed, the nurse will assist you in preparing for the exercise test. The nurse will take time to prepare your skin to attach stickers with electrodes to monitor your heart rhythm during the test. It may be necessary to remove some hair from the chest of male patients to ensure a proper connection. Next, the electrodes will be attached to leads coming from the metabolic cart. Then you will be fitted with a mesh vest to keep the leads secure as you exercise. Finally, the physiologist will fit you with the proper mask to be worn during the test. Once this is complete, the nurse will record a resting blood pressure as you are seated. Then you will be ready to mount the chosen ergometer for the test. The test can be done using a treadmill, stationary bike, arm cycle ergometer, or a reclining table for taking echo as you exercise. Once aboard the chosen ergometer, the test will begin by taking measurements at rest for 1 minute. Then you will begin an easy warm-up phase to prepare you for more vigorous exercise. Once the warm-up phase is complete, then the intensity of the exercise will gradually increase. As the exercise continues to gradually increase, the nurse will be recording your blood pressure every few minutes. The nurse will also show you a chart for you to provide your perceived exertion. Simply point at the number at the chart that represents your perceived exercise intensity. The goal is for the exercise to become so difficult that you perform maximum exercise between 8 to 12 minutes. The physiologist and doctors monitoring the charts as you exercise will be able to determine when you start to fatigue by what is being read. They will try to push you to reach a maximum effort. Once you signal that you have reached a maximum effort, the intensity on the chosen ergometer will be reduced and you will enter a recovery phase. The recovery phase of the test will last around 5 minutes as you cool down from the intense exercise. The nurse will continue to record blood pressure readings. Meanwhile, the ECG and breath analysis will also continue during your recovery. Once the recovery period is over, the mask will be removed, and you will then dismount the ergometer. Next, the mesh vest will be removed using scissors, and the ECG leads will be disconnected from the electrode stickers. Finally, the electrode stickers will be removed. You will be provided with water and a towel. Also, our facilities offer a shower and changing room if you choose to bring a change of clothes and freshen up after the test. The physiologist and doctor will need time to review all your results to provide a detailed report of the measurements taken and their interpretation. The results can be discussed in a follow-up appointment with the doctor and clinician and will be provided in a comprehensive report on our online platform.